A focused neurologic assessment. Remember that as always with the assessment we'll follow in a methodical head-to-toe approach, but this time we'll specifically focus on the neurologic system. And that consists of two parts really, which is number one, the cranial nerves, and number two, the peripheral neurologic assessment. Now you can incorporate the neurologic assessment as you're working your way in the head-to-toe fashion, or you can just complete the neuro assessment first and then go back and assess the patient's heart, lungs, belly, and all those other things that we always assess for. Just keep in mind that always stick with one way of doing it so that you don't miss anything when you're actually performing the assessment. And then for the neurologic assessment, we need a little bit more tools than usual. So we will always need our stethoscope. In addition, we'll need something that the patient can smell. In this case here, I have some toothpaste. And then we'll also need a reflex hammer. But if you don't have one of those, you can always take the side of your stethoscope as a reflex hammer. That's another option. And then something that'll allow you to have the patient tell you if they're feeling sharp or dull. And in this case, I'm going to use a Q-tip, a cotton-tipped applicator that has a sharp edge, which is the wooden end, and then the other end, the soft edge, which is the cotton-tipped applicator. So let's go ahead and take a look at this focused neurologic assessment right here. Hi, my name is Petra. How are you today?
I'm all right.
I'm going to be doing your assessment, but first let me ask you a few questions. What's your name, please?
Steve Jones.
Okay, what year is it?
2022.
Excellent. And where are we at right now? What facility is this?
We're at the hospital.
Okay, and what brings you in?
I'm having headaches.
Okay, so let's take a look at you here. Let me wash my hands and put on some gloves. So first we're going to assess your sense of smell. Can you please close your eyes and occlude your right nostril with one of your fingers and let me know what you smell.
Toothpaste.
Okay, keep the eyes closed, occlude the left nostril. And what do you smell here?
Toothpaste.
Okay, excellent. So then next I'm going to check your eyes. Please look straight at the top of my nose, right here. Bright light coming. And then the other side. Okay, good. And now, please look at the pen right here. And then focus on the corner of the room and the wall right there. One more time, look at the pen, look at the corner. And one more time at the pen and at the corner. Okay, great. Now just look straight ahead. And I'm going to move the pen coming at you from the side. Tell me when you see the pen, okay?
Now. 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 I already see it. Now. Now. Now.
Okay, great. And now keep looking straight ahead. And I'm going to put the pen right here. With just your eyes, follow the pen, please. Okay, very good. And then I'm going to touch your face now with this cotton-tipped applicator. So it's just a Q-tip, and one end of it is going to be soft, just so you know what that feels like, and the other one is going to be sharp. Do you feel the difference? Mm-hmm. Okay, so close your eyes, please. I'm going to be touching your face in different parts. Let me know if you feel sharp or dull.
Dull. Sharp. Sharp. Dull. Dull. Sharp.
Sorry.
Sharp. Dull. Dull. Sharp.
One more.
Sharp. Dull.
Okay, very good. Okay, and so then next, smile for me. Raise your eyebrows. Make your eyes close, shut your eyes real tight and don't let me open them. Okay, puff out your cheeks and don't let me push them in. Okay, let go of that. Okay, next I'm going to whisper some words in your ear and please let me know what you hear.
1, 2, 3. A, B, C.
Okay, very good. And then next I'm going to take a look inside your mouth. So just look straight ahead, please. Open up, stick out your tongue and say ah.
Ah.
Okay, excellent. And then shrug your shoulders on both sides against my hand. Good. Turn your head towards your left and towards the right. Good. And now stick out your tongue again and move it left and right. Okay, very good. So we are done with the cranial nerve part, and now we're going to move to your extremities. I'm going to ask you to hold your arms out like this in front of you, close your eyes, and count out loud to 10.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Okay, excellent. Don't let me press them down. Very good. Okay, relax your arms. Now with the index finger of your right hand, touch my finger, touch your nose, touch my finger again, touch your nose, and my finger again. Good. Other side, index finger of the left hand, my finger, your nose, my finger, your nose. And you can keep looking at the finger and there you go. Very good. One more time. Okay. Squeeze my fingers as hard as you can. Okay, great. Do a bicep curl. Turn the palms upside down, push against me. Okay, very good. Now let me check your pulses. Good, and your circulation here. Good, and the same thing that we just did on the face, I'm going to have used the Q-tip and ask you if you feel sharp or dull. So close your eyes, please. Sharp or dull?
Sharp.
Sharp or dull?
Sharp.
Sharp or dull?
Dull.
Sharp or dull?
Dull.
Sharp or dull?
Sharp.
Sharp or dull?
Dull.
Okay, excellent. Now place the palms of your hands up, with the palms facing up on your thighs, and turn them up and down as fast as you can. Keep going. Okay, very good. So that is the rapid alternating movement, and then we're going to move on to the lower extremities, but before I do that, I'm going to listen to your heart and lungs here while you're sitting up. So I'm just going to lower you down here for a moment and listen. Just breathe nice and normally. Okay, good. Next, I'm going to be listening to your lungs. So every time I touch my stethoscope to your skin, take a nice deep breath in and out, please. And actually, let me lower this down here. Okay, deep breath. Again. Okay, now the same thing on the back. I'll just sit beside you for a moment. Nice deep breath. Okay, very good. Next, we'll put this back up. And we'll take a look at your stomach here. Actually, are you able to just hold it up here? Good. I'm going to just be listening here for a moment. When was the last time you had a bowel movement?
This morning.
Okay. Any pain when I press?
No.
Good. I'm going to press a little harder. Any pain there?
No.
Okay, good. You can let go of the gown. So next we're going to move on to your lower extremities. And I'm going to check your strength first. Please kick your legs out against me and then pull back. Good. Push down like on a gas pedal and pull your toes to your nose. Excellent. Let me check your circulation. Other side. Okay, and then the same thing we did before with the sharp and dull on the upper extremities. We're going to do this on the lower extremities now. So close your eyes, please, and let me know if you feel sharp or dull.
Dull. Dull. Sharp. Dull. Oh no, that's sharp. I barely feel that. It feels dull, I guess. Sharp.
Okay, very good. And then next for your coordination, I'd like for you to run the heel of the right foot up and down the shin on the left side. And from all the way down to up to the knee. Very good. And do that 3 times, nice and slow. And now switch sides, please. Okay, very good. You can relax your legs. I'm going to check your reflexes here with your patella reflexes. Close your eyes, please. Here we go. There we are. Good. Other side. Okay, excellent. So those are nice and equal. And now we'll do a couple of specialized tests here. Close your eyes, please. I'm going to place an object in your hand, and I'd like for you to tell me what that is.
The pen.
Okay, very good. Now keep your eyes closed, please. I'm going to be writing a letter or a number in your hand, in the palm of your hand, and let me know what that is.
It's an 8.
Okay, and now let's check the other side.
M.
Okay, excellent. So this concludes our focused neurologic assessment. Please also check out the other videos about the specifics for cranial nerves as well as the peripheral neuro assessment, where I go into more options of how to assess certain things of the periphery. Thanks for watching Nursing School Explained. See you soon.
To better understand a client's overall health, I ask everybody about their substance use, including the use of tobacco, alcohol, cannabis, and illegal street drugs. Do you use any tobacco products?
Occasionally.
Occasionally. And what do you use?
I smoke.
You smoke? And what would you smoke?
Probably 10 cigarettes a day.
10 cigarettes a day. And how long have you been smoking?
Probably around 5 years.
5 years. Have you ever thought about quitting?
No.
No. Well, if you do, we have a multitude of resources here that we can assist you with quitting if you ever think about that in the future. Do you use any other tobacco products, such as a pipe, vaporizer, chewing tobacco?
No.
No. Including beer and wine. Do you drink any alcohol?
Sure.
Sure. And how much would you say you drink?
Probably a couple times a week.
A couple times. And what would a couple times look like?
Maybe 2 glasses of wine.
2 glasses of wine. Okay. And now that cannabis is legal in Canada, we've been asking questions about cannabis use. Do you use any cannabis products?
Sometimes when I go out on the weekend.
Sometimes you go out on the weekend. And what do you use?
No more than one joint on the weekend.
One joint on the weekend. Do you use any other cannabis products?
No.
No. And when did you start using cannabis?
Just when it became legal.
When it became legal. Okay. Do you use any street drugs?
No.
No. Okay. Have you ever felt that you had a problem with any of the substances that you use?
No, I don't think so.
No. Okay, great. Thank you.
Area, is that okay? Mm-hmm. All right, so I'll get you to uncover your underarm area, please. Mm-hmm. Just gonna tuck this in.
Thank you.
And is it okay if I touch your underarm?
Mm-hmm.
Okay. Any pain when I do that?